The head of Access Health CT, Connecticut's Obamacare exchange, says if the Affordable Care Act fails, the number of uninsured in New Haven and Waterbury would double and would be even higher than that in Hartford.
He is also warning tonight that the two remaining insurers offering individual plans in Connecticut could be pulling out within the next 5 weeks. Chief Political Correspondent Mark Davis joining us with the very latest on this tonight. Good evening, Mark.
Hi, Scott and Ann. Good evening, everyone, from the Hartford newsroom. 111,000 Connecticut residents are covered by either Anthem or Connecticut under the Access Health CT Connecticut exchange program, and they are making it very, very clear tonight that no matter what you are seeing on the internet or on social media, that if you have coverage today, you will be covered through December 31st. But after that, things look very uncertain. Access Health CT is planning to relocate their storefronts in New Britain and New Haven and add 8 more around the state, even though they don't know right now what they'll be offering to the more than 100,000 Connecticut residents currently covered by the Obamacare insurance exchange.
Our hope is that we're going to be able to, make decisions by the end of this month. And in time for carriers to make determinations.
The insurance commissioner is talking about rate hikes for next year, which would likely go up around 20%. Uncertainty prevailed at today's Access Health CT Board of Directors meeting, much of it generated by tweets from President Trump threatening to pull the plug on the federal subsidies that keep the premiums down for more than half of the Connecticut residents covered by one of the 2 carriers in Connecticut.
That adds risk to an industry that is solely based on avoiding risk.
If Trump starts pulling the plug on the payments, the next one is due on August 21st, the insurance companies will be on the hook for the difference and would make them likely to pull out entirely for next year. The state is unable to make up the difference.
As you know, we are having difficulty balancing our budget with our current range of expenses, and so that would be an additional expense that would be difficult for the state to assume right now.
Access Health CT says they are making plans for that possibility and will be ready when enrollment for next year begins on November 1st.
Some people might be able to buy directly from the carriers at a different cost, but and in this case that we've been talking about, there might not be any financial help available to them, but that is an option for them.
Now, Anthem and Connecticut must decide by September 8th, just a little about 5 weeks from now, whether or not they're going to stay in the Access Health CT exchange under Obamacare here in Connecticut. That's why the insurance commissioner wants to try to establish the rates by the end of this month. And hopefully by then we'll know if the Trump administration is going to continue those subsidies. The next one is due to the insurance companies on August 21st. Live from the Hartford newsroom, Mark Davis, News 8.